Hello and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and reduce stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan Behavioral Health of Pennsylvania here in the Lehigh Valley. On this episode of the podcast, we discuss post-traumatic stress disorder, or PTSD. We discuss the impact of PTSD on those affected and some of the supports and services available, as well as efforts to promote awareness about PTSD, such as recognizing June as PTSD Awareness Month. During the episode, we focus our attention on the impact of PTSD on military veterans. We get help with this conversation from our special guest, Tom Applebach. Tom's the director of the Lehigh County Office of Veterans Affairs, and he shares his perspective about the impact of PTSD and other mental health diagnoses on our military veterans and their loved ones. Tom also talks with us about the concept of moral injury and what we as community members can do to get involved in supporting our military veterans and their loved ones. Be sure to stay tuned. At the end of the episode, we will tell you how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now, here's my conversation with Tom Applebach. Well, hello there, Tom, and I really appreciate your being with us for this episode, and thank you tremendously for sharing with us and our listeners during this episode. If you could, would you introduce yourself, maybe a little bit about your background, and in addition, your current role within the Lehigh County Office of Veterans Affairs?
Well, glad to be here, John. Thanks for inviting me. It's a real pleasure. I am currently I'm the director of Veterans Affairs for Lehigh County, and we'll get into that a little bit more. But just brief background: I'm retired military. I spent 12 years in the United States Air Force as a weather forecaster. I've heard all the jokes, John, so don't try. And then I left the Air Force and went over to the Army Reserve as a civil affairs specialist.
Okay.
Spent a year in Iraq almost 20 years ago. It's hard to believe it was that long ago. But then I retired from the military in 2006 and had several jobs, but now I'm here at Lehigh County, and best job I've ever had. Love my job.
Well, that's great. And I think a perfect background for our topic for this episode, which is PTSD, but really with a focus on overall mental health. The support and the role that your office plays in supporting military veterans and their families and loved ones. Some of the basics about PTSD, and we're not going to necessarily get into the weeds on the clinical side of things, but it is something that it can happen to anyone. It's usually something that occurs following a life-threatening incident or experience that someone has. And of course, when you think about military veterans and the tasks and experiences that they all have, certainly that, in addition to just traditional mental health diagnosis and disorders, it's something that can affect them and impact them in their lives, their quality of life. Certainly, like I said, we'll get into talking about some of the stigma of mental health and PTSD. But I'm interested to hear, just from a kind of introductory standpoint, when you think about PTSD or mental health overall, and the work that your office does supporting veterans, can you give just kind of a general perspective in terms of mental health and the interface with your office?
Definitely. Just to be clear, I work for Lehigh County. There's an Office of Veterans Affairs in every county of Pennsylvania. We are not the Department of Veterans Affairs, but we work closely with them on certain issues. And I'll also be very clear, I'm not a clinician or a therapist. I have a master's of public administration, which means I'm a well-skilled bureaucrat, but not a clinician by any stretch. And our office we work mainly with veterans and surviving spouses on veterans benefits, and for veterans, a program called VA compensation, and that's a monetary benefit for injuries, illnesses, accidents that were incurred or caused by military service, which remain chronic, meaning that a head cold is not, but some sort of physical injury or mental injury or something like that, or illness, may be applicable for that. When it comes to mental health, our veterans, especially those who've seen combat, or what they call instrumentalities of war, which means training, sometimes when you're doing live fire, things like that, or even especially military sexual trauma, MST. And that could be male or female. I've worked with males with MST.
Okay.
But when you come out of the other side of the military, be it 4 years or 40, there could be mental health repercussions, shall we say, as a result of your service.
Yeah.
And that's, we're not therapists here,
right?
But we work with getting the benefits. But most importantly, I was on the phone this morning without violating HIPAA with a veteran who, this veteran was talking about MST. And my first question is, are you working with the VA mental health, or are you receiving mental health services? That's the focus, is let's get into that realm.
Yeah, make that connection.
Absolutely.
Make sure there's a connection. Yeah, gotcha.
And this person had just about a month ago kind of worked up the courage to contact the VA clinic here in Allentown, and is now working with psychologists. And let's. The stigma is not what it used to. I still understand embarrassment and so forth, but we got to get rid of that damn stigma. I don't know how else to say it. And actually, it is getting better.
Yeah, I was going to ask about that. And of course, one of the mission statements and goals of our podcast is just that, is to help reduce stigma around behavioral health, mental health overall, and certainly PTSD being something that impacts the overall population. As I mentioned, anybody could be diagnosed with PTSD. And I think military veterans, certainly through the scope of their work and some of those examples you cited, are maybe more so potentially at risk. But just that example you gave a moment ago is to me, helps me to kind of get a better visual understanding of the role of your office, which is you'll get that outreach, and then you want to make sure they've got the appropriate connection and support in place before then moving forward with the actual kind of your lane, right? Yeah. And then when we think about stigma, again, one of the goals is to help reduce stigma, and simply by having conversations like this on podcasts, op-eds that people will put together, and other content, I think we're making progress. It may be kind of incremental, but again, my belief is just a conversation helps people to maybe understand or something to resonate that may help them to make that call to reach out or to have the conversation with someone they're concerned about. But from your perspective, in particular with military veterans and the interactions, when you think about kind of your role and what you all do, have you seen a difference in terms of the stigma specific to mental health and military veterans?
Well, it depends on what you mean. If you're talking about the general populace or you're talking about veterans, I can address both.
Yeah, actually, because it might be helpful in a comparative way from your perspective.
Yeah, for veterans, I think more and more, I think it's sort of a chicken and egg sort of thing, because we have a good number, if you will, of veterans who are receiving mental health services. If they encounter another veteran and they have that sort of discussion, there's your mentor right there. Like, hey, I'm in therapy.
Right.
I'll take you there. I'll make the phone call. So it's kind of a brothers in arms sort of thing.
Looking out for one another.
Yes.
Yeah.
So if a veteran is not afraid to talk about it to another veteran, that's very helpful.
I would think so. Yeah.
For my office, if they're not enrolled, we encourage that they call, but we also work with some social workers over there to do sort of a warm handoff to at least get that connection started.
Right.
When it comes to the general population, it's not too many years ago, really, especially with the veterans returning from Iraq, Afghanistan, when PTSD became more known, or under, what's the word I want to use? PTSD was part of the lexicon.
Yeah.
versus, Vietnam and prior to that. And there was a lot of misunderstanding, like, hey, thank you for your service in Iraq, but please don't coach my kid's soccer team because I don't want you near my children because I don't know. And that hurt. I mean, that's very hurtful.
Yeah.
And that's not PTSD. And I'd like to think that the general population sort of understands that PTSD does not mean I'm a crazy killer or whatever you want, I'm going to go triggered, per se. I'd like to think that that's getting better. And maybe that's one of those kind of more incremental. I think on the veteran side, it's the stigma has definitely decreased.
Okay. That's
I think on the general population side, it's a little bit of a different story.
Yeah. Interesting.
Of how they view mental health.
Yeah, and I think for me, just thinking about how you were describing that with the veterans returning and kind of the perception, I think, and misperception, frankly, and just again speaking for myself, from my own experience, I think I didn't know very much, and I could only imagine the experiences that the veterans coming and returning home had. But I do think over time, through education and promoting awareness, and again, I think having conversations has certainly helped myself to learn more, to kind of put things in a different perspective. But I would tend to agree just from the general population. I think overall mental health, still there's the stigma, unfortunately, and anything we can do to assist the general population, but certainly military veterans who are, stepping up for us and, putting themselves at risk of experiencing more traumatic events and more life-threatening events, which again, I think puts folks at risk for mental health and PTSD in particular.
Yeah, there's no doubt that military service can cause mental health issues, anxiety, depression, etc. But at least more veterans are willing to admit, I have a problem. I don't know how else to say that. But then be willing to seek that treatment, and in some respects be more open with their family about things. Because again, I'm not a therapist, and I know that we're going to a little bit. We'll talk about some other issues here, but I think it's very, very important that, and I'm certain you'll agree, that the family and community, maybe friends, however you want to describe it, not just aware, but they're part of the therapeutic process.
Yeah, definitely. And now a brief message for military veterans and their loved ones. Are you a veteran in crisis or concerned about one? Well, the Veterans Crisis Line is a toll-free confidential resource that connects veterans in crisis and their families or friends with qualified, caring U.S. Department of Veterans Affairs responders. Veterans and their loved ones can dial 988 and then press 1, or chat online at veteranscrisisline.net/chat. Or you can send a text message to 838-255 to receive free confidential support 24 hours a day, 7 days a week, 365 days a year. You can also get additional information by going to their website at www.veteranscrisisline.net. And now, back to the show. You're right. I think it's that finding your voice to say, I need some help. I need some support. And I think, again, just generally across in the entire population, that's probably the most difficult part of the process is acknowledgement and the ability to, really be vulnerable and make that really scary raising of the hand. I need some help here. I'm dealing with something that's impacting the quality of my life. It's getting in the way of my relationships. It's increasing conflict. I mean, name your, kind of symptom that someone might be experiencing. But that first step, I think, is often the most difficult to just ask for help.
Again, that's where the family, friends, and so forth.
Yeah, exactly.
And your veteran friends as well.
Yeah.
I'm talking about that. Yeah. Those close knit.
Yeah. And I would think your office is perfectly situated to, you maybe get some of those calls even before, as you mentioned the call earlier, where someone is just newly reaching out, getting set up. Maybe they are, but maybe they're not.
Right.
So.
And this person, conversely had finally worked up the courage to reach out to my office for the benefits side.
Right.
So we start to get the package put together, if you will, the mental health treatment or therapy or whatever you want to call it, and then the benefits side on our side. And I was lax in pointing this out. Now, again, there's a county office of Veterans Affairs in every county.
Okay.
But there are also in certain areas in the state, or actually across the country, are what are called vet centers.
Okay.
And they're actually part of the Department of Veterans Affairs, kind of the medical side, the Veterans Health Administration, as it's called. But they're sort of an adjunct, if you will.
Okay.
And there's a vet center in Philadelphia. I think it's down in the Coatesville area. There's one up in Scranton. Unfortunately, not one here in the Lehigh Valley.
Okay.
But veterans and even families can contact them. It's all, what do I want to say? It's all private. It's all,
anonymous, confidential. Yeah.
And they can work with veterans with mental health and other issues, employment issues, and so forth. To sort of get them, especially for those veterans who don't want to be in the hospital,
right?
I don't know, setting, the clinical setting.
Yeah.
The vet centers are a godsend. They've actually been around for a good number of years.
So it's community based, so you can, whatever the need is, you can identify that need. They can help triage that and identify the right resources.
And, Denise Carey, who's the director up in the Scranton Vet Center, is just awesome person. She's been doing this for 30 some years now.
Oh wow!
And she's just awesome.
Yeah,
so
it's great. It's within the system. It's great to hear that folks are really dedicated. Obviously, there's a lot of institutional knowledge there to help support folks with the right resources and connections to be made. So,
exactly.
And that kind of segues a little bit into to your office specifically, the Lehigh County Office of Veterans Affairs. If you could, just kind of a 10,000 foot view, kind of some of the, how many folks are there, what's the typical kind of structure within the office and the tasks or duties that you guys do day to day.
Well, my office is myself and two staff. Every office, because we're county offices, varies in staffing. For example, Northampton County, Alex Carrillo's office, it's Alex as the director, Neff as one of his staffer, and then he has an administrative assistant.
Okay.
And when I use the word staffer, I should be clear that all the county directors by state law are required to be accredited veteran service officers through the Department of Military or through the Department of Veterans Affairs.
Okay.
The Veterans Administration. Most staff are veteran service officers. That's up to each county. But for example, my two staff, Gail and Karina, are both accredited veteran service officers. So they're well trained. They've been doing the job for a good number of years. And we're through the training. Then we legally can file those claims and so forth and so on. But each office varies. Some of the northern smaller counties may just be a director.
Gotcha.
Some of them not even full time.
Okay.
Other offices have more staff.
Right.
It's just how they're laid out.
Kind of individualized to that specific.
Yeah, we what's nice, if you will, is because we don't work like some states have everything's under a state umbrella.
Okay.
But because we're county, I can tailor my office and I can tailor our focus and our projects on what's affecting the Lehigh Valley, because I work very closely with Alex at Northampton because it's the Lehigh Valley.
Right.
There's lines on a map don't matter that much to us.
Yeah.
For example, Lehigh Valley, one of both of our focuses is homeless veterans, because we have a small but a fair number of homeless veterans in the valley. You might get up to, and I'm just picking on a county here, Pike County, for example, much smaller county.
Yeah.
The homeless veteran population is probably not a significant issue, but much more rural. So now how do you get transportation for those veterans to get to medical appointments? How do you? So we're able to, each county office is able to focus on where they see the need.
That's great.
Rather than being directed to do things that don't, it's a square peg in a round hole.
Yeah, it's great to have the latitude to be able to be flexible to the needs of your region or your area. That's to me that makes sense. In our Magellan of Pennsylvania, same thing. We've got several counties where we do the managed care for behavioral health and substance use services, and county to county there could be different needs, so you might have different programs, or programs might offer different tracks. Just it depends on the need.
And here you have a bus service, people can get to their appointments. You get into other counties, and now how do you get those folks to their appointments?
Yeah, which can be an obstacle that, having that as a resource and identifying that as a need could be the difference between getting to those appointments and getting the proper care or not. And that's enormous in my view. Yeah.
Absolutely.
Okay, that's really helpful to give us an orientation to the overall structure, or even within Pennsylvania.
And then, if I may, I talk about veterans benefits. That's a federal benefit. There's the veterans pension program. Don't conflate that with like a Bethlehem Steel pension.
Gotcha.
But we do a lot of other activities. It sounds a little facetious, but we say, other counties say it as well, is every phone call is a new adventure, because you never know what's going to be on the other end. From, hey, could you help me get my grandfather's report of separation from the military, to, hey, I'm homeless, to whatever. So we deal with a lot of different phone calls every day, which keeps the day interesting, if you will.
I imagine.
But we work with some state programs. We have the ability to, and I'll do my little pitch here. We have the ability to access some funding, temporary assistance funding, that can help somebody over the bridge. They were in a hospital for 2 weeks, weren't working, and now they don't have the money to pay their rent. Well, we might be able to get money to help pay that rent. So it's a bridge. Okay.
Yep.
But we tap into a state program called the Veterans Trust Fund.
Okay.
And in Pennsylvania, when you register your vehicle, there's a little checkbox. Would you like to donate $5 to the Veterans Trust? That's where that money comes from. So please check that box.
Yeah.
That money goes to, a great good.
Absolutely.
And it's not just going to, down a rabbit hole. We're able to tap some of those dollars to help a veteran or a surviving spouse who, for whatever reason, just needs a little help to pay, a small bill.
Yeah. And now a brief message about the Veterans Trust Fund. The Veterans Trust Fund is administered by the Pennsylvania Department of Military and Veterans Affairs. It provides grants to veteran advocates that ultimately assist Pennsylvania veterans and their families in need of housing, financial help, food, training, recovery, and more. The next time you renew your driver's license or motor vehicle registration, consider checking the box to donate $5 or $10 to the Veterans Trust Fund, benefiting Pennsylvania veterans and their families. And now, back to the show.
There's a lot of different pies,
Yeah.
if you will. But again, it sort of makes the job a little more, each day a little more interesting than just pushing paperwork around.
Oh, absolutely. Yeah, no, and then that's, I think, really helpful for our listeners to get a better understanding of just how wide and varied, the responsibilities can be and the support is. But it also, for me, drives home the point of the need.
Right.
And that's something that, and it can range. Obviously, it sounds like from call to call, person to person, but the ability to have that latitude and really focus on what's right in front of me, the need that the person or loved one has, and being able to try to meet that need.
Right.
So, we talked a little bit about families and the community supporting veterans. Is there something the general public can do to help support veterans? You actually mentioned checking that box.
Right.
Sounds like a small thing, but if that's building a fund that can really benefit military veterans or their loved ones, that's again, little things can make big impact. Are there other things that folks can do to either get involved or provide support for veterans and loved ones?
Well, I'll say two things, and I'm not sure if this is a segue for me to get off my soapbox or not. I love my soapbox, so let's be careful. We do have a fund here in the Lehigh Valley. It's called the Lehigh Valley Homeless Veteran Fund, and it's overseen by the Lehigh Valley Community Foundation.
Okay.
I want to say it's a county program, but it's not a county. I mean, I helped to set it up, but it's not a county program. But the Community Foundation acts as our nonprofit.
Okay.
And the Lehigh Valley Homeless Veteran Fund, we've had people who've done small fundraisers. We've got some grants and so forth. But in that fund, we do not grant funds. We do not make grants from that fund to individual veterans. What we've been able to do is to make some fairly large donations or grants to some local agencies that work with veterans that may have, for example, VA funding, but there's certain constraints on how they can use that. And the additional money we've been able to throw in is sort of unrestricted.
Oh, wow.
As long as it's going to a veteran or family. So if there's a need to purchase somebody, I don't know, household goods, a frying pan, a sofa, they could tap those funds that the government says, you can't do things like that or whatever.
Right.
And it's a wide example.
Yeah.
Unfortunately, with the rising cost of rents in the Lehigh Valley, a lot of the funds that we were able to give in the past few years have gone to hotel stays.
Okay.
Because it's so hard to find housing, affordable housing here in the valley. But that's fine. We've gotten a homeless veteran or a homeless veteran's family, in a hotel. They're safe.
Yeah.
They're warm or they're cool, whatever the case may be.
Right.
And then the process of trying to find, the housing and so forth can move forward a little better.
Gotcha.
So while I would prefer that the money wasn't needed to be used for that, if that makes sense.
It does.
But that's the purpose of the money.
Right.
So
that's why it's there. Okay.
So if people wish to donate to that, they can go to the Lehigh Valley Community Foundation website.
Okay.
You got to poke around a little bit, but find the Lehigh Valley Homeless Veteran Fund, and any donation it is tax deductible.
Okay.
Which is why we partnered with them.
Great.
But I did want to talk about and a little bit about when we talk about mental health and the question about how can community, sort of segues very nicely into an area, if you will, it's called moral injury. Some people refer to it as soul injury. There's some other names for it. Again, I want to be clear, I'm not a clinician. Right. I'm not. But if I'd like to spend a few minutes kind of talking about that and explaining it, and we'll see. I'll get into how the community sort of has not just a role, but a responsibility.
Yeah. No, I think that would be great for our listeners to hear about moral injury. I think when we spoke prior to the recording, we kind of touched on this, and I was very intrigued to learn more and hear more about this, and I'm sure our listeners would be as well. So absolutely.
So moral injury, and I'm going to read you I'm going to call it the accepted definition.
Okay.
Because it's a little still being formulated a little bit. But the current definition is moral injury is perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. And one of the things with moral injury, especially when we're talking about the military, is it's something that occurs in a high pressure, high stakes, quick decision sort of scenario.
Right.
And in the military, especially in a combat situation or something, there's high stakes.
Yeah.
Life is potentially on the line, and to perhaps oversimplify is. It's sometimes I should have or I shouldn't have. I should have pulled the trigger, and I didn't, and bad things happened. I pulled the trigger, and I injured or killed someone that I shouldn't have. It can also be being ordered to do something that harms your morality, and this gets a little kind of nebulous, if you will.
Sure.
One of the best examples for me of moral injury, and I know I'm somewhat showing my age, but for those who are familiar with Vietnam and the My Lai incident, where Lieutenant Calley saw these villagers on one side, U.S. soldiers on the other, and he knew that the soldiers were going to pull the trigger. And he landed his helicopter between the two groups. And what if he had not done that? How would he feel?
Right.
Okay. I should have done that.
Right.
And that was a high stakes situation. So the issue becomes, most people understand PTSD, or at least if I say PTSD, people kind of say, oh, I know what that means, I know the definition, and so forth.
Right.
Whereas moral injury has this definition, but you don't know it when you see it,
Right.
if you will.
Right.
Some people have said moral injury is the flip side of the coin of PTSD.
Okay.
And research has shown that they can be separate, and there can be an overlap. And the overlap are things like startle reflex, nightmares, things like that.
Yeah.
PTSD. And I'll admit, when I came back from Iraq, I had, I'm going to call it a touch of PTSD.
Okay.
That is since, over the 20 years has resolved itself. And in many cases, PTSD, and again, not a clinician, but
Right.
PTSD will, if not resolve, at least moderate, maybe I should say. Whereas moral injury, what studies are showing is moral injury gets worse over time, because you may have done something or not done something that you're embarrassed, you're ashamed, you might think you're going to go to prison if somebody finds out. You're afraid to tell your spouse about it, and it gnaws at you.
Yeah.
Okay.
Yeah.
What we're finding statistically is, when we talk about veteran suicide, our highest rate of veteran suicide, believe it or not, are veterans over age 55. And the theory is, well, they're retiring, they're puttering around in their workshop, they don't have the kids, the job, and all the other distractions, and now they get a little time to get inside their head.
Right. Yeah. Alone with their own thoughts.
Alone with their own thoughts.
Yeah. Okay.
And I mean, I'm going on a limb here, so please don't anybody. But I'm going to say that because moral injury does not exist in the DSM, the Diagnostic and Statistical Manual, boy, say that 3 times fast. I think we have a lot of veterans who are diagnosed with PTSD who either have moral injury or an overlap.
Okay. Yeah.
The problem is there's the VA or mental health providers, especially when we're talking about like VA compensation dollars, there's no diagnosis for moral injury.
Okay.
So you need that diagnosis of PTSD to get them into treatment.
Gotcha.
Which is perfectly acceptable. The idea, especially when I talk about this, is the idea is when we have our mental health professionals, be them social workers to psychiatrists, this is something to get into their toolbox.
Yeah.
To try to understand and wrap it into their treatment.
Yeah.
So hopefully that sort of makes a little bit of sense.
It definitely does. Just hearing you kind of the distinction really between the PTSD and moral injury, I can see how things are designed now, and kind of the thought process of probably practitioners who are dealing with someone who is presenting with certain symptoms. But from a treatment standpoint, I think it would be challenging. Again, if you don't have a formal diagnostic category or diagnosis for moral injury, what's your approach going to be? What treatment modality will you use? How will you define, quote unquote, the problem within the treatment plan? What are the goals and objectives within the treatment plan? So that's kind of the framework that clinicians would use when it comes to treatment. But we're talking about moral injury. Which, it's not that it's abstract, but it's harder to.
You've nailed it. You've absolutely nailed it. As a matter of fact, I thought I had his name right in front of me, but one of the pioneers of this was a VA psychiatrist who was doing the standard, sort of, shall we say, the textbook treatment for PTSD, and it wasn't working.
Right.
And he something more is going on here. Now other researchers have dove into. As a matter of fact, the VA started a program about 2 years ago to finally start to study this holistic thing called moral injury, and checklists are starting to be developed to at least, so they're trying to understand it, but it's a little bit like trying to pick up mercury. But what's most important is people are starting to pull this into their treatment toolbox, into their modalities and so forth. But back to your original question was, what about the community?
Yeah.
And this is where a friend of mine, a psychologist, Dr. Roger Brooke with an E, out of Duquesne University, and others have done this, but he's a huge advocate of this. And he essentially says that our military, we're warriors,
Right.
and these ancient societies would send their warriors off to war, and then they took the responsibility to bring their warriors home, whatever that means, but to welcome them back into the community,
Right.
Help them to forgive them their sins that they performed on behalf of the community.
Yeah.
And we've lost that.
Yeah.
And a lot of times it's like, oh, I'm sorry to hear that you're having some mental health problems, Mr. Veteran. Go to the VA, they'll fix you. And my work here is done.
Right.
And Dr. Brooks' argument is none of the community sent us to war. It's the community's responsibility to bring us home. What does that look like? Thank you for your service. That's the start of the conversation.
Yeah.
That's not a break point. That's
Right.
So tell me about your service. Don't ask. I mean, believe it or not, I came back from Iraq and I had somebody ask me, did you kill anyone? And it wasn't a 4-year-old child. It was an adult.
Yeah.
That is not the question you ask. Tell me about your service. What was it like? Was it hot over in Iraq? Whatever. But it's about building those relationships, those communications, and so forth. But again, Dr. Brooks says it's the community's responsibility to bring them home in some form. Does that mean on the back deck with your neighbor, drinking a beer, shooting the breeze, giving them that space? I'm not a therapist, but I know how to have a conversation, a human conversation, and not isolate this person.
Yeah, I was just going to say, you used the phrase break point a moment ago. Thank you for your service, period, right? And you do hear that, and it's, I think it's important to say thank you to our military veterans and probably their families for supporting them while they're in service. And stepping up for our community. But yeah, it seems like the conversation should go beyond that.
It has to.
Yeah, to your point.
In some way, shape, or form.
Yeah, and I think about, like you described, moral injury, whether it's PTSD or moral injury or some other mental health diagnosis. From a community standpoint, I think, again, a lot of it is around being willing to have a conversation. And now, a brief word from Magellan. If you or a loved one are a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. And now, back to the show. So we as the community don't learn what people are kind of up against and having difficulties around. And the person who's having difficulties doesn't get that engagement, maybe has difficulty accessing it or initiating it from their side of things. And so there's a miss there.
Right.
So there's a missed opportunity, I feel like, just as a community to be open, to allow people to tell their story, share their experiences, and hopefully then make some connections and really promote communication and support. And I don't think, I said earlier, I like to think the best of people. I don't think it's because people don't care. I just think, and it's true of mental health too, it's having the conversation is difficult. What if I say the wrong thing? If I ask the wrong question? Right. So I think that's part of it. I'm not speaking for everyone, but again, speaking for myself, those are hard conversations to have. So it's thank you for your service, and now I'm moving on and you're moving on,
right.
And feeling like it's not complete. Complete.
Yeah, you're right. And nobody's trying to be a bad person.
Right.
And I'm not suggesting someone needs to initiate a hard conversation. Sure. I mean, you wouldn't do that to your neighbor on the back deck.
Right.
But it's sort of about building a little bit of that trust.
Yeah. Yeah.
A little bit of, perhaps, what did you do in the military? Well, this is, I served in Vietnam. Where were you? I don't know anything about Vietnam. So where were you? Wow, that must have been really difficult. Maybe sort of those probing comments.
Yeah.
Not necessarily to get them to open up to you, but perhaps to get them to open up to themselves.
Yeah.
That can move that process forward.
And that's kind of what I was thinking. So again, any interaction takes at least two people. And so a conversation is just that. It's a conversation. It's not so much treatment, therapy, or anything like that. I'm suggesting rather just as humans having these conversations and being generally interested and curious, because I think when people engage, they're able to tell their story. They probably in a lot of cases want to tell their story.
Yeah, and again, that's with the moral injury, you've got that shame, you've got that amelioration, you have those factors where people aren't willing to, and I understand.
Right. It does make sense. Yeah.
I've done something wrong, or I believe I've done something wrong.
Mm-hmm.
I'm certainly not going to sit here and, during this podcast and blurt all this stuff out.
Right.
Not that I have anything to blurt.
Right. Sure.
But again, it's just a little bit of that community responsibility, which entails the conversations. We were talking before the podcast, and we both play golf.
Mm-hmm.
And sometimes on the golf course, you have some of the just best conversations with somebody you've never met before.
Very true. Yeah.
And that's kind of all I'm saying here is I guess at the end I want people to sort of understand moral injury is out there, or soul injury, or whatever you want to call it. Mm-hmm. With hopefully some people, a little light bulb went on and just went, oh, that's interesting. And if you're a therapist listening to this, or someone, you could say, well, I was working with a veteran, and that makes a little bit of sense to me.
Right.
And now it's your job to learn more. Right. Okay.
Yeah.
But it also, again, it's sort of that community responsibility. I spent 21 years in the military. I'm not going to say I loved every day of it, but I'm very proud of my service. Mm-hmm. I would do it all again. I enjoyed serving my country, but not just for patriotic wave a flag thing, but because that's who I am, and I enjoyed serving for my fellow citizens, if that makes sense.
It absolutely does.
The word, I didn't do it for the money. And most veterans will feel that way. Yeah. And it's when they feel like they've done their duty, and now they're just told, well, I'm sorry, you go to the VA, they'll fix you. Right. And it's a little dismissive, feeling. And so I don't want to belabor the point too much. I don't want to go down too deep of a hole where I get myself in trouble. Sure.
Well, but at a very basic level, it's about increasing our understanding and being open to learning. I didn't serve in the military, but I certainly have nothing but respect for anyone who has. And I do think, again, speaking from my own experience, not for others, it's been, I've learned a lot talking to you through this conversation and our earlier conversation and preparing for the podcast. And I think there's a human connection that can be made from a community standpoint. It just, again, raising awareness and increasing our understanding, I think, helps us, but it certainly also then kind of helps us to feel more comfortable to go have these conversations,
exactly,
to engage with others,
exactly.
So that it's not an us and a them, it's a we, right?
Yeah, and that's the whole. Yeah, you're exactly right. It's a we, and we all have different lived experiences. Yeah. But it's a we at the end of the day. Yeah. And if we don't have community, what do we have? Yep. We have a bunch of individuals who, I don't know, it doesn't mean anything at the end.
Right. And if we're part of, any community, and we see someone who may be having challenges or difficulties, I mean, it's incumbent on us to step up and to lend support, to be available. Yeah. To your point, you have a specific role within serving military veterans. It's not a clinical role, but you help them make sure they're connected and with other resources too. Right. So it's some of that those basic things that can really make it, and it can make a big difference.
You're right.
And so a conversation, while it may not necessarily, be a clinical conversation, could be that neighborly conversation you talked about, could help someone to feel a little more reassured. Hey, it felt good to connect. Maybe feel even better to kind of take some additional steps, get some help around some of those feelings that you described, the shame and the worry about telling the story.
I'm not going to say it's the stigma, because moral injury is a little different,
right,
if you will.
Right.
But again, it's okay to talk to a professional. And I'm not saying don't work with a professional.
Right.
But there's the community side that needs to be part of the mix. Yeah. That
totally makes sense.
If I may, there's a couple of books and stuff I'd like to just recommend briefly.
Yes,
for those who are intrigued or interested. There's a book by a journalist. It's called "What Have We Done?" and it's sort of a treatise on the Iraq War and so forth. But it's with moral injury. Warriors Return. That's by Dr. Edward Tick, who has done deep studies and deep dive into this moral injury conundrum thing. And another book, and it's called Achilles in Vietnam. And I apologize, the author escapes me, but it's Achilles in Vietnam. It's 150 pages long. And he basically takes the story of Achilles and puts him in Vietnam and talks about the warrior's process. You can read it in 2 nights. And then read it again. But Achilles in Vietnam, really, really, really good sort of small primer to sort of stoke your fires.
Right.
And then there was a little movie that came out maybe 10, 15 years ago. And it's called Thank You for Your Service. And it's about some soldiers coming back from Iraq. And my wife and I we'd talked about moral injury at some point when I had first met Dr. Brooke, and I said, "Oh my God, this whole moral injury thing is just so cool!" And oh my God, it makes sense.
Yeah.
And a couple of years later, on Netflix or something, it's on streaming. Thank you for your service. And I said, "Hey, let's watch this." And we're like halfway through the movie, and without spoiling anything, she turns to me and she goes, "That's moral injury." And I said, "Boom, you got it."
Yeah.
Because it's these guys struggling with the moral things that happened that harmed them,
right?
Rather than that old trope of PTSD,
right? I gotcha.
And that's why I said I'm careful to say, but we have a lot of veterans with a diagnosis because there is no moral injury diagnosis,
right? Understood.
And that's fine as long as the therapist is sort of working in this moral injury thing to are they suffering from this as well,
right? Right, so that they can account for it in the work they're doing and the support they're providing.
Exactly.
Okay. Is there one, from your perspective, what would be the most important thing that folks should know about their county Office of Veterans Affairs?
That we exist.
Okay.
That's the hardest thing. Sometimes people will say, "Oh my Lord, we just found out about you. We found about these programs."
Yeah.
My father was a Korean War veteran. My mom is in an assisted living facility for 2 years. We just found out that she may be eligible for some financial assistance, things like that. And that always breaks my heart.
Yeah.
But okay, now we've connected. Let's go. So it's that the County Veterans Affairs Office exists. They're a great, we're a great resource to either get things done or to get you where you need to be.
Yeah.
And for those, that we're talking to, I know we keep saying veterans, the preferred actually is, did you serve in the United States military or your spouse?
Okay.
Statistically, females do not identify as a veteran, but if you ask them if they served, they'll say yes.
Right.
So, but if our audience here didn't serve in the military, but their neighbor did, then let them know there's a county office out there. I'll be very, very clear because we have some entities out there that we kindly refer to as pension poachers. The county serve, there's never a charge. Okay. It doesn't matter if it's a quick phone call or we're spending hours and hours working issues and claims. There's never a charge.
Okay.
So don't hesitate. Your tax dollars are paying for our services. But that's the biggest thing, really. We exist. We're here. We can't do everything, but one of the things that, more than anything, every county office has done, our county director should be doing, plus we have resources, we know what agencies are out there.
Right.
People use a term that say we're going to tear down the silos, and I don't understand that because I'm an expert in my silo. Mm-hmm. But we've built a lot of bridges to other people's silos.
Right.
And we can get you try to get you where you need to be.
Right.
And not lose sight of you. We're a huge subscriber to the no wrong door theory of, I'm not going to keep sending you to 12 different places. I'm going to try to get you where you need to be the first time. If it's a warm handoff, it's a warm handoff. It's if you say, hey, I got this, I'll make the call. That's perfect. And if you have any problems, call me back and we'll figure out what went wrong.
That's awesome.
And that's really what, that's what we're here for. We're here to serve our, not just our veterans, but their families with whatever their questions may be.
That's wonderful, and it's great that you guys are out there doing this awesome work. And I really appreciate your taking the time to come on to talk with us, to educate our listeners. Hopefully it does something to raise the awareness around and the visibility, not only around your office, but just, overall with military veterans, their loved ones, and for all of us, how we can get involved, be involved in whatever way we can as a community to support them.
And I think the key word there was community.
It's
and we, I may work for the county, but I'm also part of the community.
Right. Yeah. Well, that's great. Well, thank you again for coming on.
Magellan.
Yes, we are. And while we're a large, national company, the Magellan PA folks, we're here. We're part of the community. We live here. And so it's always great to meet someone from the community, someone who's providing support and services to the community. And, it's increased my knowledge, so hopefully it's done the same for our listeners.
And my work here is done.
I thank you again for coming on, Tom. I really appreciate it.
It's really been a pleasure.
Stick around. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned about the diagnosis of PTSD and that it can affect anyone. We also learned about PTSD and other mental health diagnoses and their impact on our military veterans and their loved ones. We learned about the work that the Office of Veterans Affairs in Lehigh County and other counties here in Pennsylvania are doing to support and advocate for military veterans and their loved ones. We also learned about moral injury. We learned what it is and how, although it does have some things in common with PTSD, there are differences as well. We learned that researchers are working every day studying moral injury, increasing their understanding about it, and exploring potential treatments and other supports that focus on moral injury. And lastly, we learned that if you are interested in getting more information or getting connected with your county Office of Veterans Affairs, you can reach out directly or check out your county's website for more information. We'd like to thank our guest for this episode, Tom Applebach, the director of the Lehigh County Office of Veterans Affairs. We'd like to thank all of you for listening to this episode of the podcast and invite you back for our next episode. And remember, if you have any questions or feedback about the podcast or have suggestions for future episodes, send me an email at jglees@magellanhealth.com. Well, there's the music, letting us know we've come to the end of another episode. I'm your host, John Lee, saying goodbye for now. And please remember, behavioral health matters.